Hey guys, welcome back to the channel. Dr. Don here. So today I want to talk about understanding diabetes. It kind of triggered me to shoot this video yesterday when a client told me that I have learned more talking with you in 30 minutes than I have being a diabetic for the last 20 years. And that really struck me because I tell everybody the more you know about your condition, the more you know about your body and what's going on that's causing the symptoms that you're dealing with, the faster you're going to get well, the faster you're going to live the life that you want to live, do the things that are necessary in order to heal that body back to normal function so that you no longer have whatever the symptoms that you're dealing with. Now, obviously we're talking about diabetes today. Typically what we see is a lot of diabetics that are diagnosed on a routine office visit to where, you're going in for an annual checkup, or you're going in for some other issue like the flu or the cold. And sure enough, the doctor sits you down and he tells you that you have diabetes. He tells you need to lose weight, you need to exercise, you need to improve the way you eat, and go ahead and start this medication. Typically, that looks like something like metformin. And so, what we see is that patients are not educated on what diabetes is. Again, this gentleman I was talking to, he's been diabetic for 20 years. He is on insulin, he's on 2 different oral medications, he's on blood pressure medication and cholesterol medication. Before diabetes, he was on 0 medications. Now he's on 8 different pharmaceuticals that he's taken every single day. Some of them he's taken twice a day. And again, a 30-minute conversation with me on the phone, he learned more about his condition than he did over the last 20 years. There's something majorly wrong with that. I think that is one of the contributing factors to why the standard of care is once you're diagnosed with diabetes, you get worse with time. We don't typically see people improve their health condition once they're diagnosed. And so, let's kind of break down what diabetes is, because again, my goal is to educate anybody that I work with, just the public in general. I love to educate you because the more you know about your condition, the faster you're going to get well. So diabetes mellitus, that's kind of the umbrella term. Diabetes came from a Greek word that means to pass through. Mellitus came from a Latin word that means sweetened with honey. So the way that they used to diagnose people with diabetes is when the urine tasted sweet. So think about that. How did they diagnose people? If it tasted sweet, I guess somebody had to determine if it tasted sweet. So imagine being a lab tech back in those days. Yes, people tasted people's urine, and that's how they determined if they were diabetic back in the day. So diabetes mellitus is really any condition to where the sugar is elevated in the blood. Now, for sugar to pass into the urine, aside of drugs like Jardiance, there are specific medications out there for type 2 diabetes that forces that sugar to bypass the kidneys into the urine. And again, the ultimate goal is just to get that sugar out of the blood. But in general, the threshold, if you will, when the sugar gets up around 170, 180, depending on the integrity of your kidneys, how well your kidneys are functioning, around 170, 180 blood glucose, that's when it will start to overwhelm your kidneys and the sugar will get into that urine. So back in the day, they weren't able to determine diabetes until the sugars were very, very high, again, up over 170, 180. Now, as far as determining diabetes, lab testing for diabetes, and then we'll kind of get into the different types of diabetes, the gold standard to determine do you have diabetes? Do you have pre-diabetes? Kind of how well is your body processing sugar is called a hemoglobin A1C. And so they consider a 4.8 to 5.6 normal. 5.6 to 6.4 is typically where they consider you pre-diabetic. And then once you hit that threshold over 6.4, you're considered a full-on type 2 diabetic or just a diabetic in general, depending on the conditions, which we'll talk about here in just a second. And then over 7.0 is where they consider you an out-of-control diabetic. Now, the research is very clear. Again, from a functional standpoint, right? I'm a functional medicine doctor. My goal is not to manage disease processes. My goal is to get your body back to functioning normally so you don't have the disease process anymore, right? And so the research is very clear that at 5.3 is where we start to see negative effects, especially on the brain. And so I like my patients' A1C to be between 4.8, 5.2. That's an ideal, perfect hemoglobin A1C. A lot of you that are diabetic, they're told that as long as you keep it under 7, you're doing a pretty good job. And the reality is that's a true statement. Most people have a hard time keeping their A1C under 7. But at the end of the day, in order for no damage to occur, in order for you to not reach the complications of diabetes, we want to see that A1C get under 5.3, definitely under 5.8, 5.7, 5.6, okay? Now, different types of diabetes. The most common form or type of diabetes is an adult onset diabetes, type 2 diabetes. Now, this is originally known as adult onset. Unfortunately, more and more as the years go on, and listen, I've been doing this for 10 years, and very rarely did I treat teenagers or young adults with type 2 diabetes. But nowadays, there's teenagers and people in their 20s and 30s that are developing type 2 diabetes, which is a case of insulin resistance. So the pancreas is almost never the problem with type 2 diabetes. The pancreas is the gland. The beta cells in the pancreas is what secretes insulin. Insulin is the hormone. One of its jobs is to get that sugar out of your blood into your cells so that your mitochondria can use that sugar for energy. Now, with insulin resistance, again, it's a metabolic disorder. You can't cut somebody open and take out their diabetes because it's a multitude of issues going on that has led to insulin resistance. And now your cells no longer are utilizing that insulin properly. And so they start to resist or desensitize themselves to that insulin. The number one reason why type 2 diabetics get worse with time is because a lot of medications just focus on increasing how much insulin is being secreted. And there's other medications that are just trying to drive that sugar into different parts of the body. But what the medications do not do and cannot do is fix the insulin resistance. And so in order for someone to completely walk away from diabetes, not be dependent on drugs, not be dependent on a bunch of herbs, you have to eliminate the insulin resistance and get that body back to normal function, okay? So type 2 diabetes, also known as adult onset diabetes, is a case of insulin resistance, not the case of insulin dependent, meaning you need more insulin. Now, with that being said, a lot of type 2 diabetics, a lot of you guys watching this video, you have become dependent on insulin injections, even though you were originally diagnosed as a type 2 diabetic. So what we are now is a insulin dependent type 2 diabetic. I know it gets a little confusing, but at the end of the day, the more insulin you put in your body, the more insulin resistant you're going to become. And so this is one reason why once people do start insulin therapy, injecting themselves with insulin with type 2 diabetes, what do we see happen over time? You become more and more insulin resistant. And how we see this go is when you initially start insulin, they usually start off on a low dose, say 10, 15, 20 units once a day. Those sugars sure come down. You may get a little energy boost and you think to yourself, man, why don't we do this a long time ago? But again, 3 months in, 6 months in, 12 months in, you go back to your doctor for follow-up exams. Sure enough, that doctor's not happy with your blood sugars. Your blood sugars are going up. So you tell me, those of you that are taking insulin, what is the recommendation at that point? Exactly correct. They're going to increase how much insulin you're putting in your body. So if 20 units was effective at keeping your sugars, say, under 150 consistently, now it takes 40 units to do the same thing. What did you just see happen? You just saw your body become more and more insulin resistant. See, the sad thing is once you're diagnosed with diabetes, anytime there's an abnormal symptom, anytime there's a lab marker outside of a normal range, the answer or the solution is always another drug. And when it comes to insulin therapy, once they start you on insulin, the only thing they can do is continue to give you more insulin. And then once the long-lasting insulin becomes less effective, then they start on the fast-acting insulin that you inject every meal. And again, we just see that ball start to roll faster and faster down the hill. And this is where we see people's health decline pretty rapidly. Again, not saying that to scare you guys. This is just the reality of the situation. Those of you that are a type 2 diabetic and are looking at going on insulin or being told it's only a matter of time, it doesn't need to be that way if you address the problem of insulin resistance. We have to stop focusing on the symptoms and focus on why your body has developed the disease in the first place. Okay? Now, type 1 diabetes. Type 1 diabetes is a case of insulin dependence. So this is usually juvenile onset. You're born with it, or you get it very early on in life. But again, Like type 2 diabetes, we never saw it in young kids. Well, type 1 diabetes, we're starting to see it more in adults that are developing this disease. And the reason being is because most of the time there's an autoimmune component. Your immune system attacks the beta cells in the pancreas, and now the insulin production starts to be reduced to the point to where you can no longer secrete insulin, and now you are stuck taking insulin for the rest of your life. And so again, type 1 insulin dependence usually is a case of an autoimmune condition. Right now, for those adults, just talking to a gentleman the other day, he's about 54, 55, diagnosed with diabetes, got put on metformin. He's been on metformin for 6 months. His A1C keeps going up and up and up. His fasting sugars keep going up. The metformin is absolutely ineffective. So I said, well, has your doctor looked at pancreatic function? He said, no. How do you look at pancreatic function? So guys, there's a marker called C-peptide. There's a marker called insulin. There's a marker called proinsulin, okay? This can give you an idea of how much endogenous insulin, how much insulin your pancreas is secreting. So I recommended he go to his doc and get these markers ran. They ran the C-peptide. His body was not secreting insulin. If your body can't secrete insulin, metformin, Jardiance, glipizide, all these oral medications are gonna have no effect on your blood sugar. So unfortunately, a lot of your doctors are not running the markers looking at pancreatic function, but if your oral medications are little to non-effective, then most likely you're having some pancreatic fatigue. Those beta cells are just not able to secrete insulin. And again, most of the time, it's more of an immune system problem and not a pancreatic problem. But what is the treatment of choice? Let's just prescribe insulin. The problem with that, if it is an autoimmune component, that immune system is just going to start tagging other parts of your body as a foreign invader. And this is when we see people start to develop things like fibromyalgia or hypothyroidism, rheumatoid arthritis. Again, just other autoimmune diseases, because if you just put insulin in the body, it doesn't fix the immune system problem, okay? So type 1 diabetes, insulin dependent. Your body's just not making insulin. Type 2 diabetes is a case of insulin resistance. Your cells have desensitized themselves to the insulin, but the insulin is still being secreted and is still there, just not doing its job, okay? Now, gestational diabetes is something that we see that affects pregnant women. Sometimes gestational diabetes will go away after pregnancy. Sometimes it hangs around. Again, a lot of times it's one of the two. It's a case of you're not secreting enough insulin. There could be some immune system issues. When a woman gets pregnant, the immune system does a different thing. The first trimester changes action the second trimester, and then again the third trimester. And a lot of times through those major changes, that immune system to become aggressive against the body can affect insulin production. And again, if that's the case, you have to take insulin while you're pregnant. Hopefully that autoimmune condition corrects itself after pregnancy. A lot of times it does not. And then again, we have to go in and find out why that immune system is not functioning the way that it is. And then sometimes again, it's a lot of pregnant women. It's kind of an excuse. Guys, don't hate on me. I'm not saying this. It's true. There's a lot of women out there that it's an excuse to eat more. I'm eating for 2 people now. The reality is an extra apple a day is enough calories, additional calories to grow that baby and support that baby. So you don't need to eat double the calories. You don't need to be on a 10,000 calorie diet if you're pregnant. But what happens is you get cravings when you're pregnant. You get these things, and so you're eating more sweets. So and if that's the case, you may become insulin resistant. And then, again, doing things like metformin and things like that may temporarily help. But guys, you gotta stop putting the sugar in our body. That's the main driver of type 2 diabetes and insulin resistance is diet. Unfortunately, a lot of you guys are watching a video like this because you're researching, you're trying to do everything you can to reverse your type 2 diabetes. And, you've improved your diet, you're exercising, and then you plateau. And a lot of times, unfortunately, just diet and exercise is not enough to reverse all of the metabolic damage that you've caused over the years that has led to type 2 diabetes. So if that is you guys, number one, I hope you got some information out of this video. Don't forget to subscribe to the video. Give me a thumbs up for the video, guys. There's a lot of people out there that appreciate this information. I like when I see the thumbs up. It kind of motivates me to do more videos. And obviously that bell icon is going to help you get notified when I do put out more videos. But listen, if you are a person that is struggling with diabetes and you've either not made changes because you don't know what to do because all the information online is contradicting each other, or you've made significant changes and are not getting the results that you want to get. guys, reach out. I'm going to put a link in the description below that will allow you to set up a free call with me. Now, if you're not serious about your health, if you're not willing to make more changes, don't waste your time. Don't waste my time. This is only for people that are very serious about reversing their diabetes, taking advice from myself, following specific protocols. What are those protocols? Well, the reason I don't sell programs online is because you need to have a treatment plan customized based off of what your body needs. You need to have a diet plan based off of how food interacts with your physiology when you consume that food. So, I customize my treatment plans based off of the individual. So if that's something you're looking for, if you just want guidance, you want some help, if you want me to be your tour guide on your journey to wellness, guys, there's a link below. You can schedule a 30-minute call at no cost for me to discuss really in detail what I can do for you and determine whether or not you're a good candidate for my program so that you can get amazing results like everybody else that I work with. So guys, God bless. I hope you got something out of this video. Guys, share this video around like Facebook, Instagram, all those places. Get this information out. Everybody knows where to go get drugs and surgery. Not a lot of people know where to go get true health care. Love you guys. God bless. Have a great day.